What is the difference between a chiropractor, a physical therapist, and who should I go see? That is a question that I get so many times, especially here on social media. So I thought I would take a minute to just answer that. So let's first talk about what are the differences between a chiropractor and a physical therapist. Now, full disclosure, I am a chiropractor and I deal with a ton of physical therapists. First off, I want to say I absolutely love the physical therapists that I work with. They do amazing work. So I have nothing bad to say. Now, the two main differences are this: chiropractors, from a broad perspective, work primarily with the spine and musculoskeletal disorders that affect joints. Physical therapists, on the other hand, work with the entire body, but their primary goal is to restore movement, motion, and strength. Now, there is a lot of crossover between the two because a lot of times when you go to a chiropractor, like myself, we do some amount of physical therapy. We teach stretches, exercises, etc. My main mode of intervention is the chiropractic adjustment, meaning I put my hands or a tool in a certain way to cause the body, to cause the nervous system to be affected with a chiropractic adjustment, which then neurologically resets a lot of the joint spaces, the mechanoreceptors, allows a lot of the muscles to react and become stronger and more receptive. Now, when we're talking about physical therapy, they're primarily using modalities, ultrasound, stem, sometimes shockwave, or different types of modalities to help ignite the body's nervous system via the muscles. Now, how does that work? They do it by stretches, they do it by exercises, they do it by different proprioceptive motions and movements. Now, the question is, who do you go see? Now, it really depends on a couple things. So first off, if you're dealing with primarily only a muscle issue, meaning if you have a spasm in your shoulder or even your lower back, and it doesn't last more than just a few minutes to a couple of hours at a time, then typically the physical therapist is the better person because they can address the muscle specifically. Now, if it's something that is chronic, that's happening over and over again, it's here one week, it's gone the next week, it's here one week, it's gone the next week. Typically at that point, we're not dealing with just a muscle issue, we're also dealing with the adjacent joints. And that's where chiropractic plays an amazing role because we can go in there, provide a powerful adjustment, realign everything, take the pressure off of that joint space, off of those mechanoreceptors, off of those nerves, and restore movement and function back in the area. Now, lastly, how do we work together? Great question. A lot of times people, for instance, will come in with lower back pain or sciatica. My job is to get everything back into alignment. And then if the stretches and exercises that I prescribe to them are not fully able to help restore motion and let the patient be back to their normal activities of daily living or back to their sport, then we will work with the physical therapist to help reinforce that by making sure that they're doing more stretches, they're doing more exercises. Maybe they need more modalities and more soft tissue work than I can provide or I can do in my clinic. So we work with the physical therapist on that end. Now, PT does amazing with helping to rehab injuries back as well. Like if you have rotator cuff syndrome or you're dealing with like a chronic knee bursitis or plantar fasciitis, those types of things. So when you think about it, chiropractic is really good about getting things back in alignment, lining things up. Maybe you sprained your ankle, okay? So now you're going to physical therapy to decrease inflammation and to restore motion and movement. Great. But you also want to see a chiropractor because we can get all those bones in the foot realigned, and that helps to increase the function of the foot, as well as it'll help when you go to PT to strengthen everything back up. So really, in actuality, we really work hand in hand a lot with physical therapists. Like I said, I have nothing bad to say about PT at all. They do amazing work. They're great at what they do. We typically refer to physical therapy probably about 50 to 60% of the time when a patient comes into my practice. And I really feel like it does an amazing job as far as helping the healing process, restoring motion, movement, gaining strength back, as well as it really just kind of enhances the work that we do as far as chiropractors. So thank you guys for these questions. That's why we're answering them. Let me know what your thoughts are. Do you like to go to physical therapist first? Would you prefer to go to your chiropractor or maybe even your medical doctor? Curious what you guys have to say. Talk to you later.